Hi, I'm Dr. Lorenzo Cervantes. If you're watching this, it likely means you or a loved one has been diagnosed with cataracts. This video is here to walk you through what cataracts are, when surgery makes sense, what surgery involves, and the lens options available, so we can spend our time together answering your personal questions and making the right decision for your vision and your life. Let's start with the basics. Everyone is born with a clear lens inside the eye, just like a lens in a camera that helps focus light. As we get older, that lens gradually becomes cloudy. That's what we call a cataract. Now, not all cataracts are the same. Some people have mild cataracts that bother them a lot. Others have very advanced cataracts that don't seem to bother them much at all. So how do we decide when it's time for surgery? I offer cataract surgery to people whose vision is getting in the way of how they live, whether it's interfering with reading, driving, hobbies, or even just safely getting around. Sometimes people don't realize how much their vision has changed until it starts affecting what they want to do. In other cases, the cataract becomes a safety concern, like when someone is still driving, but their vision has gotten dangerously poor. That's when we talk about surgery. Cataract surgery involves removing the cloudy lens and replacing it with a clean, clear synthetic lens called an intraocular lens implant. It's an outpatient procedure done in an operating room. We operate at either Griffin Hospital or the Surgery Center of Fairfield County in Trumbull. Both are excellent facilities, and patients have great experiences in both locations. The decision usually depends on your insurance, your health, or your schedule. The surgery itself routinely takes less than 30 minutes. You're awake but relaxed. We numb the eye with medication and give you some light IV sedation. You go home the same day. There's no hospital stay and no significant pain. I'll see you the very next day to make sure everything is healing well. For about a month after surgery, you'll also be using prescription drops to help the eye recover. Many patients have one eye done, then notice how bad the other cataract is. If the cataract in the second eye is bad or distracting, we can move pretty quickly to take care of that one too. Once both eyes are done, you're healed, done with your drops, and happy with your vision, routine care goes back to your regular eye doctor. If any problems come up, we remain available to you. As with any surgery, there are risks, like infection, pain, bleeding, needing more surgery, or in very rare cases, loss of vision. These risks are extremely low, but they're not zero, which is why we don't operate unless cataracts are truly affecting your quality of life, and why follow-up is so important after surgery. Now let's talk about lens implants, because there are choices. All lens implants will improve the quality of your vision, but how much freedom from glasses you want can help us decide which lens is right for you. A good question to ask yourself is, how independent from glasses do I want to try to be after surgery? Standard monofocal lens. This is the basic lens most commonly used. It improves clarity, brightness, and sharpness, but it only focuses at one distance, either far or near. If you choose to emphasize distance, you'll definitely need reading glasses. If you prioritize near, you'll need glasses for driving or watching TV. It also doesn't correct astigmatism, so if you have moderate to high astigmatism, you'll still need glasses most of the time. Astigmatism correcting lens, toric lens. If you have moderate to high astigmatism, we can use a special lens to reduce or eliminate it. These lenses are designed to improve distance vision, so you may not need glasses to see the world around you, but you'll still need them for reading or computer use. These are only for people with significant astigmatism. Multifocal lens. Multifocal lenses are designed with concentric zones, each for a different distance. Most zones are focused on distance. Some zones are for intermediate, like your computer or dashboard. Some zones are for tabletop reading. These lenses can make someone much less dependent on glasses for most daily activities. However, you still might need reading glasses for tiny print, dim lighting, or things held very close to your face. One trade-off: multifocal lenses create halos around lights at night. Most patients notice them, but still prefer the glasses-free lifestyle they offer. Light adjustable lens, customizable after surgery. This is the most advanced lens option for people who want the most precision. It's made of a special material that can be adjusted after surgery using a painless light treatment. So if your eye heals in a way that leaves you needing glasses, we can fine-tune the lens to give you better vision, even weeks after surgery. Patients undergo 3 to 5 painless light treatments to lock in their final prescription. This lens is great for people who want to test drive their vision before finalizing it, especially those who've had refractive surgery in the past or who are very particular about their visual needs. All surgeries carry some risk. The most common short-term effect is dry eye, which happens to some degree after any vision correction surgery. Symptoms of dry eye can include grittiness or irritation, redness, fluctuating vision, or sensitivity at night. That's why it's important to manage dry eye before surgery, especially if you already have symptoms. We'll go over instructions to help with this, including lid hygiene, warm compresses, remembering to blink during screen time or reading, and using preservative-free lubrication drops. For some patients, we recommend a more advanced dry eye treatment plan before surgery to minimize post-op dryness. We can go over that in more detail when you're here. Ultimately, the main goal of cataract surgery is to improve the quality of your vision so you can live better, safer, and more comfortably. Reducing your dependence on glasses is a secondary goal, but one we can absolutely try to achieve, depending on your needs and preferences. When we meet in person, we'll go over everything together. But now that you've got the big picture, you're in a better position to ask the questions that matter most to you. And together, we can make a plan that fits your life and your goals. Thanks for watching. I look forward to meeting you soon.